Thank you for joining us for today's COVID-19 briefing. Before we begin with COVID-19, let me first start by saying how deeply saddened I was to learn of the assassination of President Moise in Haiti overnight. I had the pleasure of meeting the president in 2017, and his passion and compassion for the people of Haiti was certainly fully evident then. My thoughts and prayers are with the former president's wife and family, and I'm sure I join many of Newfoundlanders who have been to Port-au-Prince and in rural Haiti doing medical missions as we express our deepest condolences to our friends and colleagues who continue to work in Port-au-Prince and amongst the Haitian population. I wish them all a very safe return to normal, a safe period of mourning, and a safe period of democratic transition for this during this tragic time. My friends, July 1st, we welcomed people to our shores. Some newcomers, some tourists, and some who just wanted to come home for the first time in a long time. And I'm sure that we've all heard the stories of the warm embraces that are truly heartwarming and are a great reward for the sacrifices that we all made. But we know that we are only able to do this, to be so welcoming, to be so open because of the rates of vaccinations. And I'm proud to say that we're amongst the leaders, not just in the country, but in some of our communities around the world in the rates of vaccinations here in the province. But please do your part and get vaccinated. It is safe and it is the best weapon against COVID-19. Today we have over 500,000 doses delivered into ERMS. We have over 80%, 81% of the eligible population have been vaccinated, and almost 25% are fully vaccinated. And a special congratulations to the Nunavut government, who have achieved incredible rates. 86% with one dose. That has to be some of the highest rates in the entire world, and 72% with 2 doses. So well done to President Lamp and the Nunavut government. With that, I'll turn things over to Dr. Fitzgerald for today's update.
Thank you, Premier. Good afternoon, everyone, and thanks for joining us. Since media yesterday, we have no new confirmed cases of COVID-19 in our province. The total number of cases now stands at 1,400. There have been 2 recoveries since yesterday in Eastern Health, leaving 14 active cases in the province. There is no one hospitalized as a result of COVID-19, and a total of 162,045 people have been tested. While we have 14 active cases in the province, 12 of these are contained on the ship anchored in Conception Bay, and they pose no risk to the community. I would like to thank Eastern Health staff who once again boarded the ship to conduct the tests, and we continue to work closely with the Public Health Agency of Canada to support the health and safety of the crew and follow up as needed. Today marks day 7 since we lifted travel restrictions, permitting non-essential travel into the province. We've reported only 2 confirmed cases in the past week outside of the ship in Conception Bay, similar to what we were seeing in the weeks leading up to Step 1. This has been reassuring. Anyone traveling to the province must complete the new form online, and this can only be done within 72 hours of travel, as anyone partially vaccinated must upload their negative pre-arrival test results within this time frame. This new form is not an approval or a denial. All travelers are permitted to enter the province. The travel form is simply the mechanism for anyone arriving in the province to declare their vaccination status and determine their self-isolation and testing requirements. Nationally, the epidemiology continues to show substantial improvements, and Canada is now reporting less than 400 cases a day. Individuals under the age of 30 comprise almost 40% of the total reported COVID cases in Canada. And this is not entirely surprising, given that the 20 to 30 age group has the lowest vaccination rates. While the reason for this is not entirely clear, it is concerning for several reasons. We know that unvaccinated individuals provide an opportunity for the virus to multiply, potentially evolve, which could lead to reduced vaccine effectiveness. And while vaccination is an individual decision, it is clearly a decision that impacts more than just the individual. Second, while vaccination is important for all eligible age groups, the under 30 cohort is our biggest risk factor for COVID transmission at this time because their age group is more likely to work in places where physical distancing is more challenging, and they are exposed to more contacts in multiple bubbles with family, roommates, co-workers, for example, and they are more likely to participate in gatherings than other age groups. We encourage communities and organizations to think of how they can best reach out to this population in their own areas. If you have any new or creative ideas to improve immunization rates in this age group, please reach out to your regional health authority or partner with a local pharmacy. We can still spark an outbreak in a setting where there are largely unvaccinated or partially vaccinated individuals in attendance, and it would be incredibly unfortunate for this to happen at this stage when we are so close to achieving our vaccination goals and easing further restrictions further. We are otherwise doing remarkably well with our COVID vaccination program, and I remind everyone to book your first or second dose if you have not yet done so. The regional health authorities continually monitor the uptake of vaccination clinics and adjust the availability to match the anticipated needs. At times, time slots are added in order to increase the availability in a shorter time frame. In those situations, people are able to rebook for an earlier date, as long as it's been at least 8 weeks since your first dose. Please be assured that the adjustments are made to ensure that vaccine doses are not wasted. Over 80% of our eligible population has at least one dose, and one dose provides good protection, but 2 doses is better. You are considered fully vaccinated once you are 14 days past your second dose of a 2-dose vaccine or past the first dose of a single-dose vaccine. Being fully vaccinated is certainly the safest way to attend gatherings and events, to participate in sports, and to travel. These are all good reasons to get vaccinated, but the most important reason is to protect yourself from severe illness associated with COVID-19. Being fully vaccinated also makes it very unlikely that you can transmit the virus to others. So please make the choice to vaccinate for yourself, your loved ones, and your community. 24% of our eligible population have had 2 doses, and we expect this number to rise rapidly in the coming weeks. To make this happen, we need everyone to take the vaccine offered to you. This is safe and effective, and it is common practice in vaccination programs to interchange brands. I know that there are concerns about being able to travel internationally, and it is important to remember that we are still in the midst of a global pandemic, and countries are still navigating through a very difficult and uncertain period. So we need to give this time. Our priority is and will continue to be protecting the health and well-being of our population. We need a significant proportion of our population fully vaccinated to provide us all with effective protection and allow for the return to the new normal in our province and country. Until that time, everyone needs to continue doing their part, continue wearing masks in indoor public spaces, distance from others who are not your close contacts, and if you have even one symptom of COVID, stay home and book a COVID test. As a recap for anyone just joining us, there are no new cases of COVID-19 today, and the total number of cases in our province is 1,400. The end of the COVID marathon is in sight. We need to pace ourselves and make sure we get this right. If all goes well, we will be in a very different place in just a few short months. So hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald. I'll now turn things over to Minister Haggie for some brief remarks.
Thank you very much, Premier. Again, a delight to hear low numbers. It has been a busy week since Canada Day. And in the first 4 days of the month, so up to 3 days ago, we've had over 10,000 travel forms completed. Presume by now most of those people would have arrived within the province. We're certainly seeing plane loads in St. John's, Gander, and Deer Lake, as well as Warbush. I'm delighted to say that despite concerns at the beginning around the paperwork and one thing and another, there has been really very little in the way of issues, and I'd like to thank the staff at the airport who have looked after this process and the staff who've been dealing with travel forms behind the scenes. From the point of view of going forward, we have an ample supply of vaccine, and Dr. Fitzgerald has explained quite clearly the rationale behind the 8 weeks. It's better for everybody. It's better protection. And the fact that you can mix vaccines, an mRNA vaccine is an mRNA vaccine, and it really doesn't matter whether you had Pfizer or Moderna. From the point of view of going forward, as Dr. Fitzgerald has just said, the marathon is nearly at an end. This has been a marathon with hurdles, and the last few are nearly behind us. So I don't really think I need to say more than get your shot and continue to follow the public health guidelines. So thank you very much, Premier.
Well, thank you, Minister. I'll now invite questions from the media.
Thank you, Premier. For the benefit of our speakers, we have 2 media in person and 2 joining by phone. The first round of the question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions are from Jody Cook with NTV. Please go to the mic. Thanks.
Good afternoon. Just to dovetail on what the health minister was just talking about with vaccinations, with manufacturers recommending 3 to 4 weeks between first and second doses, and our province's inventory, is there any consideration to maybe even changing yet again second doses to sooner than 8 weeks?
So at the moment, we aren't considering that. The manufacturers make that recommendation based on the trials that they do at the time. Real-world evidence, is something else that we rely on to inform our programs. And certainly there is some evidence that's suggesting that perhaps a longer interval may provide higher levels of immune response. And because of that, we anticipate that we would get better protection, longer protection. And that's why we've chose the 8 weeks in between. So it's not just about getting everybody vaccinated as quickly as possible. It's about trying to give the best immune response that we can and the best protection that we can. So, at the moment, we're not considering it, but not to say that if more evidence, as we've always said, if new evidence comes in that points us in a different direction, then certainly pivoting has become a way of life over the past 18 months.
So is it fair to ask then, is there any consideration here that this is in part a resource issue, or is it mostly an epidemiology and science reasoning?
So I think it's a bit of both, and certainly, it's right now, we've always tried to let the science lead the way, but there is some room. I think there's capacity within the regional health authorities, but at the moment we're trying to let the science lead the way.
Our next questions are from Mark Quinn with CBC. Please make your way to the mic.
Good afternoon. We've been getting reports that people are showing up for appointments, and when they were offered Moderna, they're leaving saying they want Pfizer. Is it possible to say how frequently this is happening, and is it affecting our plans to our target, I guess, of vaccinating 50% of people by midsummer?
It's probably best for the minister, but again, to reiterate what Dr. Fitzgerald has said many times, for anyone watching out there, it is safe to take the combination of vaccines when you think about if you got your measles, mumps, rubella vaccines over the years, or if you travel to foreign countries. I'm pretty confident that most people don't know who manufactured those vaccines. But Minister, I don't know if you have any numbers about if that's a small problem or big problem or not.
I don't have any direct numbers on the people who decline a vaccine being offered Moderna. What I can say is that we're not wasting any. So whatever turns up at a clinic gets administered. That by itself would suggest very strongly that it's not delaying our vaccine rollout with the second shot.
Thank you. We've also been hearing that some people are having trouble booking a second appointment. Some of them are older people, and they're questioning if our priorities have changed. They said at the early part of the pandemic, we were prioritizing older people because we thought they were more vulnerable, and now it seems like some of those older people are having trouble booking a second vaccination. Has something changed?
It shouldn't have, but Minister, if you want to.
From the point of view of the rollout of the second dose, we did have that staging period where we did it on a priority basis. that lasted for some weeks. And then when the large supplies of Moderna were on the horizon, we moved to a booking system based on 8 weeks since your first dose. If there are challenges, and we've heard people are really very keen to get their second dose, and the RHAs are adding more clinics pretty well every day or every second day. So keep checking back, and you'll get your appointment.
Thank you.
We will now go to the phone. Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. Some other provinces have dropped their mandatory mask requirements. Our reopening plan states that that's not set to be reviewed until Phase 3, which would be September. But with other places making decisions now, will this province conduct a review of those rules sooner?
I mean, as Dr. Fitzgerald has said, we are always continually reevaluating the evidence, the real-world evidence, the epidemiology, and adjacent jurisdictions. I mean, you just heard that there's only 400 cases in Canada today, and of course, we all know that it wasn't that long ago that would be a victory for one province in particular. So, I mean, we're always reevaluating things, but and we'll see where we are in August and as we move into September. But it's certainly something that we're all evaluating.
And some jurisdictions, Britain, or some countries, Britain, for example, are preparing to administer COVID booster shots to vulnerable populations come the fall. Is that something that Newfoundland and Labrador is preparing for?
So certainly at this point, those discussions are happening, but we are certainly awaiting evidence for how best to do that sort of thing. I don't think it's any secret that the question of boosters has come up on, on many occasions, and it is certainly a topic of conversation, but there's certainly no firm plans at this point. But, once we know that information, obviously we're certainly going to put that out there and let people know. So conversations are happening, but no firm plans at this point.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Good afternoon. The second dose numbers, they've climbed, noticeably, about almost 5% in a week. But the first dose numbers, they really have moved rather glacially. Dr. Fitzgerald, you said you want to reach a certain threshold, but you haven't really stated that. Would 80% or thereabouts be sufficient, do you think?
So our goal, as we outlined in our plan, would be that 80% of people get the first dose. If we look at step 2 of our plan, it's 80% with first dose, 50% with second dose. That's certainly good. We would like to see it as high as absolutely possible. I mean, if it could be 100%, I'd love to see that. But we'd certainly encourage, just because we've hit 80% in some areas of the province doesn't necessarily mean that people should stop getting their first doses. We would still encourage people to get out there, get their first dose. The higher the percentage or the proportion of the population that has been vaccinated, the better our protection is. And so, while we're happy with 80%, we certainly would be happier if we could see it go higher. And of course, as we've said many times before, really you need 2 doses to make sure you have the maximum protection possible. And our goal is to see at least 80% of the eligible population, which is still not 80% of our total population, but of the eligible population, get vaccinated. Certainly we're seeing in the uptake in certain groups is going to be much higher than that, or we anticipate that it'll be higher than that. And we'd love to see it, 90+% in every age group if we could.
Okay, thank you. And I also would like to ask, since there's no reason for a fully vaccinated person to get a test if they're traveling here, why do they still have to fill out the travel form within 3 days before arriving?
So we want to be able to, so people who are fully vaccinated need to upload their vaccination records. So that's why they have to fill out that form. The most recent, we want it to be as recent as possible, and for people, for fully vaccinated, that means at least 14 days have passed since your last vaccine or your second dose. So, I think just for simplicity, it's 72 hours before, so that everybody is the same.
Okay, thank you.
I will now go back through each reporter to see if you have one final question. Jody Cook with NTV, do you have a final question?
Yes, thank you. Premier and collective team here, we know that travel has taken a huge hit in Newfoundland and Labrador. Obviously, opening up on the 1st of July has been a big boost for our province's tourism. But we're looking at flight prices, and I know that about a couple of months ago, you had indicated you were in direct contact, obviously, with the Prime Minister, and he indicated that he would be taking a look at those prices. We're still seeing exorbitant prices. Have you had any further conversations with him about that?
I have not had any conversations further to that. There is a First Minister's call next week. I'm sure it will come up. But I do know that Minister Crocker has been in contact with the CEOs of the airlines and has raised that with them. We all recognize the high prices right now, and it is a barrier to entry, so to speak, to our province, and we're looking to see how we can solve that collectively. But I'm sure that will come up in the First Minister's call.
Mark Quinn with CBC, do you have a final question?
I do, thank you. Dr. Fitzgerald, from my understanding, is the first big event that's coming is the Iceberg Alley Festival this coming fall. You mentioned how you're concerned about young people and the vaccination rates. I imagine it would be a lot of young people gathered at an event like this. How do you decide if an event like that goes ahead, and what's your group's role in determining if those events go ahead?
We certainly have the organizers for Iceberg Alley have reached out, and we have had conversations and exchanges about, how we felt what needed to be in place for things to happen safely. And they've been quite open to our suggestions, so that's all very reassuring. They are actually, recommending that people be vaccinated before they come, doubly vaccinated before they go to the event, which is really good. And, we certainly thank them for encouraging that messaging. We would like to make sure that people, that we have that 80% vaccination rate, not just in the province as a whole, but in every age group and in every region. So we all need to work to get to those 80%. With regard to what would make that not go ahead, we have to keep a close eye on epidemiology. So anything that we recommend that's several months out, we have to put the caveat on it, but that's assuming that, vaccination rates are good and continue to climb, and that epidemiology is good and we don't have big outbreaks and there's not a variant of concern that's circulating, all of those things. So it's very difficult to predict at this point in time, but certainly, we're willing to work and make sure that it can be put off as safely as possible.
And of course, we're hoping to get to that 80% mark by well before that. So we're hoping to get to the 80% double vaccinated rate, and therefore theoretically herd immunity much before that date, which will provide just an incredible barrier and level of protection.
If I could, do you have a target date for that 80%?
I know we're hoping kind of mid-third week of August, but give or take. Of course, I've been off by 3 days in the past, I think.
Richard Duggan with VOCM, do you have a final question?
Yes, I do. Some rotational workers who live here have received their vaccines in other provinces. And as far as I'm aware, those numbers aren't included in our totals because they're administered in other jurisdictions. But do we have any idea or estimates of how our totals would be affected if those numbers are factored in?
When we look at rotational workers, the numbers that we vaccinated, I think were somewhere just shy of 7,000. So I don't know how many have been vaccinated elsewhere, but I don't think that it would affect our complete totals significantly.
Peter Jackson with The Telegram, do you have a final question?
Yes, I'm just wondering whether any genome sequencing is being done on the cases on that chip in Conception Bay, whether any results come back?
So the whole genome sequencing is not completed at this time, but we have had some screening results back that indicate it's the Delta variant.
Okay. Thank you.
Thank you, everyone. Premier, do you have any final comments for today?
Well, thank you all for joining us. Again, we want to see those vaccination rates continue to lead the country and, if not the world. So please do your part, not just to protect yourselves, but to protect those around you so that we can have events like Iceberg Alley and get back to having a more normal life here. We're almost there. The end is in sight, but please, please do your part. It's safe. And it doesn't matter if there's different styles of vaccine, that is safe too. I know myself, I'm going to be getting a different brand than the first one, and I'm totally fine with that. So you should be too. Have a good day.
Thank you, Premier. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.